Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yes, I'm Dr. Nikhil Kadam. I'm a consulting neurophysician working with Neurosciences Clinic. It is my own clinic in Thane and Nectar Hospital. It is also located in Thane. So I'm practicing here since last 7 years. I'm glad
Thank you.
to join this platform
Thank
with you all.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Achha. So seizure is a single event. It's actually an electrical dysfunction of the brain where the electrical impulses fire erroneously and to such extent that the patient's body starts shaking a lot. And it affects the brain by causing damage to the neurons of the brain, the basic structure of the brain.
What is epilepsy?
Epilepsy is a set of seizures. So, if one patient has had got one episode of seizure in the life, we cannot call that patient as epilepsy. But if say, a single patient goes with multiple episodes of seizure in his lifetime, then we call that patient as epileptic patients. This epilepsy requires management from a neurologist or a physician.
What are the different types of seizures and do they affect people differently?
Yes. So the seizures are mainly of two types. It's a focal seizures, like it is coming in one part of the body, like one hand, one leg, or one side of the face. Then we'll call it as focal seizures, affecting focal part of the body. Second is a generalized seizure. It affects in all parts of the body simultaneously and leads to loss of consciousness. So in first type, where I mentioned it's focal seizure, it will not be associated with loss of consciousness. And the second type, definitely there will be the loosening of consciousness, and the episodes of the seizures are very fretful. If one sees that episode, it's a fretful episode, frightening episodes. So they're different. So these two types affect differently to the brain.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
May not be. In 70% of the epilepsy patients or seizure patients, in spite of all the investigations done in the hospital, we failed to find any cause. 70%, it's a large number. But in other patients, there can be the readily available causes like head injury may lead to seizure, brain infections may lead to seizures, some metabolic problems in the body like increase in the sodium, decrease in the potassium, increase in the calcium or decrease in the calcium, that can lead to seizure. These are called as metabolic seizures. And in some cases, in rare percentage, it can be a genetic cause, like the patient's families. In families, the epilepsy may be running in different generations, like grandfathers, father, mother. The next generations also they can transfer the epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yes. So if, seizures, if we call it as, it's a motor phenomenon in the body. Motor phenomenon means there will be shaking of the body parts vigorously. The clonic movements or the tone of the body will be increased too much. The patient may have facial deviation, deviation of the eyes, frothing of the mouth. Sometimes there may be bleeding from the mouth. These are the generalized seizures which I mentioned in the first part, first question, which
Yes,
I
yes.
answered. This is the generalized seizure where the patient will be completely losing his consciousness. In focal types, it may be just staring looks. The patient may feel some dizziness, some imbalance, and later on he recovers. There will not be any loosening of consciousness, but subtle episodes in the body will tell you that the patient had a seizure episode. It is difficult to see by a general caregiver, but it can be identified only by the certified neurologist or certified physicians. The generalized part, yes, we do usually identify in general public. the consciousness will be lost and the patient have a shaking of the body parts. That can be easily identified as a seizure.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, there is a myth underlying these seizure episodes because it's, as I told you, it's very, very frightening episodes. And people in the past may not be knowing that it was a seizure which is happening. They thought that it was a curse by the god, or the patient may have something outsider has influenced the patient's brain. These kind of myths have been uh, closely linked with the seizure episodes, and it's very difficult to take out from the patient's or the caregiver's mind. But nowadays, because of the advancement in scientific knowledge, we have known now that the seizure is a medical condition. It's a brain disorder. So the myths now we have with the awareness of such a platform, we have started taking out that myth from the general public. But it is a need of hour. We have to take more awareness campaigns to make understand about the seizures. People has to understand that this is a treatable condition if you follow this well with the doctors.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yes. So the seizures can be easily managed with drugs. There are very beautiful drugs available currently with us. I think there are 7 to 8 different classes of drugs which are there to manage general as well as focal epilepsy. With even with single drug, it can be managed beautifully. But taking this drug, maintaining strict compliance with the drug schedule, maintaining good dietary habits, maintaining good sleep schedule, healthy living, this will go in long run in managing the epilepsy. So caregiver has to be well understood about the condition and how the drugs should be taken, what all the procedures to be followed before taking these drugs. This all awareness is mandatory with the caregivers.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yes, again, I told you that healthy habits, sleeping on
Yes.
time, keeping a very good sleep hygiene, taking your diet on regular basis, taking the drugs immediately after your diet, maintaining good environment, positive environment around yourself, being in good company. Don't follow any addictions in your life, like no smoking, no drugs, no alcohol, and whatever we do for all the other diseases like diabetes, hypertension, the same applies to epilepsy. A very, very good healthy habits and a good healthy living, mindful living.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes. So whenever you see any patients or anyone around you having active seizure, just remove all the harmful, whatever harmful environment or harmful things there in the environment of the patients. Keep the patients on any lateral side. Don't keep the patient supine, like lying on the back. That can cause the secretions which are there in the mouth that can go in the lungs and can cause fatal accidents, fatal pneumonias. So to prevent that, turn the patient on one side, try to remove all the secretions. Don't put hands when the teeth are clenched. There can your hand or your fingers can be injured. The seizures are going to stop in 2 to 3 minutes and the clenching will be stopped automatically. So please avoid doing any procedures or any maneuvering to remove the clenching of the teeth. That is a usual thing which everyone does. That उनका the clench हो गया है तो I have started.
Yes, yes, sir.
Yes, yes. Don't metal spoon. Do not do anything that can injure the dental hygiene of the patient. That can cause the tooth to be extracted. Sometimes the tooth has aspirated in some patients who have
Yes.
prolonged seizures. So please stop doing that. That is this message I want to give from this platform.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes, so I want to tell all my audience here that seizure is not a stigma at all. Seizure and epilepsy are managed by the drugs and good compliance with the drugs and good compliance with your healthy habits. So please take the drugs on time. Be in contact with neurologist or physician, whoever is available in your environment.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.